Here we have a radiograph of the right humerus in a patient that we know from the history is 56 years old. It's an incidentally detected lesion in a patient who came in with shoulder pain, and we can identify this focal, irregular, radiodense lesion in the proximal humerus. Let's zoom in and take a closer look. We can identify that this is predominantly a sclerotic or radiodense lesion located here. So it's located in the diaphysis of the humerus, perhaps abutting the metaphysis. It's also located centrally within the medullary cavity, as opposed to being eccentric or along the cortical margins. There is a matrix within this lesion, and that matrix is a radiodense or calcific appearing matrix. Sometimes people describe this as a C's and O's appearance. Again, the margins are somewhat irregular because what we're mainly seeing is the matrix. Superiorly, one can see pretty normal bone above this. Inferiorly, there's a little bit of lucency here that's subtle to detect. In addition, we don't see any periosteal reaction along the surface of the bone, a nice smooth cortical margin here, and we don't appreciate any soft tissue mass within the soft tissues. This is a pretty characteristic look for a chondroid lesion of bone, and most often when we see these are benign enchondromas. However, as patients get older and the lesions may get larger over time, the appearance overlaps with a low-grade chondrosarcoma, and surgical management may be needed. MR imaging can be helpful to further determine the length of the lesion up and down the medullary cavity that may not be visible with plain radiography. But generally, when one sees this type of a calcific matrix in a medullary region of the bone, it's most commonly an enchondroma.